and ads, and we really are particularly interested in younger people. So some of the research that we've been conducting deals with this whole notion of younger people, and I want to draw your attention to some of this work that's in a book that's coming out, Advances in Communication Research to Reduce Childhood Obesity. Should be out in a couple of weeks. A little bit of shameless self-promotion here, but I also mention it because many people in this room have chapters in this book, including my two co-panelists this morning. But one of the chapters deals with kids research and the effectiveness on kids' favorite brands of food and beverage. And in that particular chapter, we use something called the brand affinity score of children, the kids' top 100 most loved brands. And we go through this database where different marketers are given scores based on whether children love those particular brands. And we look at what particularly for Hispanic and African Americans, the media that the marketers use to reach children, and these are the particular types of media. But more importantly, what we really look at is the top brands that kids love. And this was a combined 2009 and 2010. As you can see, McDonald's, Oreo, M&M's, Doritos, and Popsicle. And we look at the percent of expenditures. And in this particular slide, what we see is that you look at the different types of, once again, of the media where the money is being spent. Now, the question is whether percentage of money being spent in the particular media matches the percentage of the population. So if there's targeting, you would expect that if the population is 15, 16%, but you're spending 20, 25% of your media to reach that, then you're overspending, and that's an evidence of greater targeting. And we looked at some of the beverage brands, and as you can see here, as we looked at them, the top 5, Coca-Cola, Pepsi, Gatorade, V8, and Dr. Pepper. And then if you look at the rank by Hispanic, where they've ranked in terms of what percentages or how much money they spend to reach Hispanics, Coke ranked #1, and then you can see of the top 5 beverage brands where they ranked, and then you can see the same thing with African Americans, and in there Dr. Pepper was #1 in terms of the total percentage of money being spent to reach those segments. Now, this is not necessarily children, it's just the African American Hispanic segment in total. And you can see, once again, the top 5 brands for Hispanics on the left and the top 5 brands for African Americans on the right. So let's move on to the second area. What do we know about the health impact of marketing that is targeted to low-income and minority populations? Which groups are targeted the most? This is an interesting topic because it's very difficult to get a handle on. We published a paper in Preventive Medicine recently which talked about the role of food culture and marketing activity in health disparity. And one of the things we pointed out is how difficult it is to get a handle on this because of the confounding of other factors, like we talked about the runner and the blind man and the elephant. There's so many things happening here. We look at preferences. You look at some of the preferences for, like in this case, regular colas. And you can see if you look at it by white, African American, and Spanish speaking, it will vary by brand. So then what you have to do is to understand whether the targeting is having an effect, how much money is being spent on each of those brands. And sometimes you see that the large amount of money that's being spent tends to pump up the preference for that brand, but in other times the correlation is not there. So there are other factors that also come into play. Sometimes it's the neighborhood. Here's a good example. On the one hand, you have things like McDonald's being advertised right next to a public health campaign, and they're side by side. So the neighborhood, the environment, we talked about, going back to that runner illustration where we looked at the performance. If you're from Kenya and you trained in the mountains and that's your environment, you have a different environment than someone who trained in an area where they didn't have access to the altitude and the beneficial effects of it. So as a result of that, we've looked quite a bit at neighborhoods. A couple of studies we did on billboards. Some of the authors, co-authors with me are here in the room, this one and this one. But one of the key things out of this studies, there's a sentence there: living in an upper income neighborhood, regardless of its residents' predominant ethnicity, is generally protective against exposure to most types of obesity-promoting outdoor advertising. So our environment certainly can play a major role here. We did some work in Texas when I was at the University of Texas with Mimi. We were in the same department there. We looked at the location of various outlets, billboards, fast food establishments, trying to collect data on the BMI of children in those areas and trying to make the linkage. And it's difficult to do because, once again, because of so many confounding factors. But so many of the evidence that we found For example, here in this one particular zip code, the largest number of alcoholic beverages and fast food advertisements were found in the high black and Hispanic low-income zip code. Once again, high ethnicity, minorities, low income, and we found the health effects the most deleterious, but once again, also the areas where there were the highest targeted of these types of advertising that we've been talking about. Going on to the third area, is there an association between what is most heavily marketed in these communities and the products that are most available? Well, once again, it's a confounding factor. When you look at neighborhoods, we're doing quite a bit of work now in Newark, where I'm at Rutgers now. We're using some of the protocol from the Philadelphia Food Trust Corner Store campaign, and we're going in and we're looking at specific neighborhoods to see what's available. We're doing some research on what we call food deserts and food swamps and comparing the advertising there, particularly what's being offered in the corner stores, and if we can influence the corner stores to provide healthier options. There's some really good work being done by another group at Rutgers, which are using geographic and mapping data and combining that with measuring BMIs, and we're looking at the location of all the supermarkets, the corner stores, the healthy eating options, the restaurants, and then we overlay that on top of the city of Newark, and you see the density of populations, based on where different racial ethnic groups are located, such as in this one, you can see side by side on the left, composition of block groups depicted in different colors, rate by race, and then you can see on the right how this lines up with the density of availability of food outlets. And here we look at income. But one of the good things in this group that's working on this data, as they point out here, they're going to be measuring children's BMI and health behaviors and then kind of tying that in with this work that we're doing with mapping. And I'm working with the New Jersey Partnership for Healthy Kids, funded by the Robert Wood Johnson Foundation, on the Newark part of it. And we're trying to link up with this to try and get a better handle on how targeting is affecting these neighborhoods with all the confounding effects that are going on. But it's also a question of what comes first, the chicken or the egg, as they say. You can ask that question, is the development of infrastructure, or healthy living, or is it the development of population demand for healthy living? And when you translate that into target marketing, it's the same question. Are multicultural food and beverage brand preferences driven by this marketing, advertising, and media strategies, that is, this targeting, or are these strategies designed to capitalize on food and beverage brand preferences? And I would say, based on the research that we're conducting, it's a little bit of both. And as you can see in instances such as this, you look at preferences for certain kinds of items, like we looked at chicken, fast food chicken places, Church's, Kentucky, and Popeyes, tremendous spikes in terms of preferences for those, particularly among the African American community, but then also you couple that with the targeting of a company like KFC and going into these neighborhoods. And so obviously there's an effect, but once again, it's always difficult to tease out these effects. Fourth point, why do marketers target these populations? Are there ethical issues involved in this targeted marketing strategy? Well, there's a simple reason: money. This was a recent article from Marketing News where they talked about a $1 trillion buying power of the African American community by 2015. Couple that with another over $1 trillion in the Hispanic community, and couple that with other groups, and you see that marketers are looking at this as an attractive opportunity. So from their standpoint, this is really where they want to spend and target their money. They're not as much concerned about the health consequences. And this notion of target marketing, because I was asked to comment on that, I pointed out that it's nothing new about target marketing. And I've written about this in other places, but you can go back 40, 50, 60 years and see that Coke and Pepsi were engaged in target marketing long before the concerns that we had today. A lot of that was driven by bringing, from a social justice standpoint, to bring economic parity in those communities that had been neglected. So from many businesses' standpoint, they're trying to direct resources to communities that historically have been neglected. From an ethical standpoint, Dr. Drumright, Mimi, and I have a chapter in the book on ethics. So when the book comes out, we address a lot holder to the stakeholder model. And I think that might offer some opportunities for working more so with industries who are concerned about the negative effects of targeted marketing. And in closing, I'd just like to mention one thing. As you know, I'm from Rutgers University, and so we've had some tragic effect of the storm, and I wanted to show you a slide of my house and the tree that fell in front of my house, and which I'm dealing with. And so the question becomes, when you're a researcher, you have to make full disclosure. So when I was invited to come down here, I just want to let you know this was less about sharing my views about targeted marketing, but more about having an opportunity for a hot shower and a warm bed, because I'm still without power. So thank you.